So we're going to go ahead, get started. Thank you so much for joining us today for our conversation about how we can build healthy communities and prevent child neglect. I'm hearing a beeping sound coming, so I'm going to ask my fellow presenters and panelists to mute themselves if you're not speaking, and we will jump on in. So I know we have a lot of new people joining us today. I'm very excited at how many people registered for the webinar on this exciting topic, and just wanted to let you know about this series of webinars. This is a monthly networking webinar that's an open invitation to anyone who's using the Protective Factors Framework or coordinating Strengthening Families efforts in their state or their community or their program. We invite you to learn more about Strengthening Families. If you're not already familiar with it, you can go to our website at strengtheningfamilies.net. These webinars are jointly convened by my organization, the Center for the Study of Social Policy, and our partners at the National Alliance of Children's Trust and Prevention Funds. Each month we have a different topic and guest speakers, which are coordinated either by CSSP, by the Alliance, or sometimes by a volunteer from the national network. The recordings and materials from past webinars are posted at the site listed here, and this one will be as well in a few days. So always check there and see what our past topics have been and see if there's anything you'd like to catch up on. I want to share a couple of webinar tips to make sure the webinar goes smoothly. You can either connect using your telephone or using your computer, the mic and speakers option on your webinar control panel. And I just wanted to point out, if you call in by phone, please enter the audio pin that shows up there. That's how the system connects your name, to the phone line that you've called in on, so that we're able to unmute you if you'd like to speak. If you do want to speak at some point during the webinar, you can raise your hand and we can unmute you. There's a couple other tips here on the screen. I'm not going to read through them all. I think the most important one is if you're having a sound quality issue, back in. Usually that's the best solution to the problem. But if you are having trouble, feel free to type into the question box, and one of us will help you. Just wanted to highlight a couple of our upcoming webinars. As I said, this is an ongoing series. We do it the second Thursday of each month at this time. In December, we'll be talking about reaching family, friend, and neighbor care providers to build protective factors. Very excited about that topic and exciting things that are going to be shared. Nina Caesar-O'Donnell is a member of the National Network who's coordinating that work, and she's inviting some really exciting speakers. You can register for that already at the link that's on your screen. January 14th, we'll hear about a Protective Factors approach to training CASA volunteers. Those are the court-appointed special advocates for children. And we'll hear about how in Idaho they are now getting training in the Protective Factors and changing how they're reporting to family court judges. On February 11th, we're going to hear from our partners at 0 to 3 about their model called Caring Conversations. It's the new addition to the Parent Cafe, Community Cafe, and other cafe approaches that people within the Strengthening Families Network have been using to engage parents in meaningful conversations about protective factors and about community issues that help them strengthen their protective factors. And in the case of Caring Conversations, it's for conversations between parents and providers. So with that, let's get into today's agenda. I will be sharing some updates from CSSP. Teresa Rafael is here to join us to share some updates from the National Alliance of Children's Trust and Prevention Funds. And then we'll get into our main topic, which is about expanding the conversation to build healthy communities and prevent child neglect. Meryl Levine and Sandra Colette are on the line to share really great information about that topic. And there will be time for discussion at the end. You can always type in a question if you have one as we go. Okay, so that's me, Kaylin OConnor. I've been speaking for a while without introducing myself. I'm a senior policy analyst at the Center for the Study of Social Policy, and I'm happy to share a few bits and pieces of news from the center. On our August webinar, we spoke about this paper we were working on, and it was released recently. It's called Strengthening Supports for Young Parents and Their Children, a focus on low-income rural and suburban American families. So really looking at a niche group of vulnerable young parents and their young children. I wanted to share just a quick snapshot of the infographic that's part of that report, some of the data that we were able to find to help us zoom in on these families. In particular, I think it's very interesting to look at the children under 6 or below. that are below the federal poverty line. So that rate is 23.9% in metro areas and is over 30% outside of metro areas. So while a lot of our initiatives, especially around both poverty and teen parenting, are focused in urban settings, a lot of the families who need these services are not in that area. So when we look at teen parent poverty, we know that 48% of teen mothers were living in poverty for the last year we had data for that, 2009 to 2010. 34% of those who lived with their families were poor, and 63% who lived on their own were poor. And then when we look at teen birth rates, the birth rates are actually much higher in non-metro areas than in metro areas for ages 15 to 19. And those rates have been falling across the country, but they've been falling much faster in urban areas than in suburban or rural areas. So please take a look at that paper. One of the things included, a large chunk of it, is profiles of 6 innovative programs around the country that are working in rural areas, and one that's in a suburban area, the Prosperity Project in Colorado, that are reaching these families in innovative ways using 2-generation or multi-generation approaches. So I encourage you to look those up and learn about what those projects are doing. I think there's something we can all learn from learning about these innovative approaches. I also wanted to share that the latest module in our scripted curriculum about strengthening families is now available. It's called Small But Significant Changes in Child Welfare Practice. And so, as I think many of you know, this is an 8-module scripted curriculum that we've been releasing one module at a time. It was written and developed in partnership with several jurisdictions that were implementing strengthening families in their child welfare systems specifically. Some of the training materials could be used with other audiences as well, but this is it gets nitty-gritty about what child welfare workers can do differently if they're working from a protective factors approach. So if you check on our website, you can find this module and the others. And I just wanted to share the main idea behind this module, which is we use a practice wheel here that is sort of a generic practice wheel that blends, takes from a lot of the different specific practice wheels that are used in jurisdictions around the country. And at each of these points on the practice wheel, we have some content and some exercises and tools for child welfare workers to use at that point. So when they're engaging families, when they're assessing families, when they're engaging in decision making and planning, which is often done through teaming, and making case plans, the actual interventions they do with families, as well as monitoring families' progress and case closure. So we go through each of those steps and how a protective factors approach can change how those workers engage with families. So I encourage you to check that out. You might want to share it with the Child Welfare Training Academy in your community or your state and see if they are interested in using it. We developed these, as I said, with jurisdictions that were using it, but we are very happy to share it. We're putting it out there for folks to use and adapt however it would work for their jurisdictions. And one final announcement from CSSP, we have an ongoing learning collective that's currently adding new members. It's about professionals creating opportunities for young families in foster care, specifically expectant and parenting youth in foster care. So there's a link there at the bottom of the page, or you can find this from the front page of cssp.org to find out more about that learning collective. And if you sign up for the newsletter, you'll get invited to a webinar later this month and have an opportunity to become part of that exciting work. Okay, with that, I'm going to hand over to Teresa Rafael from the National Alliance of Children's Trust and Prevention Funds for some additional updates.
Thanks, Kaylin. Those are really exciting updates to see from CSSP. We could go to the next slide. I'll go through these quickly because I want there to be plenty of time for you to hear about some of the other work we've been doing related to preventing child neglect. So one thing we're very excited about is that in partnership with the Child Abuse and Neglect Technical Assistance and Strategic Dissemination Center, known as CNTASD, we are able to begin creating an application that can be used on cell phones, on tablets, as a way to help families and those who work with families look at how to help parents identify, you could go to the next slide, Kaylin, help parents identify what are their areas of resilience, what can they draw on, and how can they take actions to increase their own resilience and even to track that change over time, and to do it all in a very kind of warm and interactive way, you know, as warm as an electronic app can be. But we're designing it so that when home visitors or even child care workers or child welfare workers, anyone who interacts on a regular basis with parents, so that you all could use it as a basis for some other discussion and work, and parents could also use it on their own to start building their own thoughtful approach to how they can identify and increase their own resilience. You could go to the next slide if you would, Kaylin. We have heard from a lot of the parents we work with that it's so important to move into that area. So we're starting with resilience. We hope to go further into the other protective factors, but this one seemed to be a really important place to start. And so we hope that as we go down the road and we get into user acceptance testing, we're working with some great developers and we're learning a lot of the language, that you all, some of you at least, might be interested in helping to pilot it and to make sure that all the features work well, that the language is good and appropriate, and just to see that it is the best it can be before we release it. So we'll send more information about that. Martha Reeder at the Alliance is leading that work, and we're working with a team of folks from the Alliance, the app developers, and parents that are involved with us in multiple ways. So very excited about that. And then on the next slide, those of you who have been coming to the call in the past few months know that we were hosting and are hosting a series of virtual convenings. We have one left, which is a week from today on November 19th. Martha Davis from the Robert Wood Johnson Foundation is a keynote speaker. These last, if you're seeing the screen, for 2 hours. And Martha will be on for the first hour, and then we'll have a couple of workshops that will fill the second hour. The first two that we've had have had a very strong response, large number of people, and very positive evaluations, and they are available on our website, or they will be shortly, to download and listen to and look at if you would like. So I think it will be well worth your time. This week on Tuesday we had Dr. David Sanders as a keynote presenter, and then a panel of parents talking about their work in advocacy at the state and national levels. And then on November 3rd, we had Christy Shook-Slack and other presentations related to poverty, economic issues, and neglect, and the interrelation between all of those, as well as a workshop on Connect the Dots, which many of you, I think, are also familiar with. But it's a great way to share information and bring others with you to hear about that. I have some slides if you want to go next, Kaylin, just giving an update on the Birth Parent National Network, which is promoting and supporting the virtual convening. And this is a national network that, if you are not familiar with, I hope you'll look into in more detail. There's more information on our website about that. And there's no charge. It's open for anyone, and the goal is really about promoting and championing birth parents as leaders and strategic partners in policy work. And we've had some really exciting opportunities going on there to speak to key congressional members and their staff, and also testifying at the state level around policies that affect children and families, always promoting a preventative approach and more connection to the protective factors framework and working with families. On the next slide, just a note that the network is open to parents who want to use their voices and to organizations who are committed to supporting parents as strategic partners in the systems reform work. So Meryl Levine at the Alliance is the lead on that, and we do hope you'll look into that if you haven't already. On the next slide, I know many of you who have been coming, oh, sorry, I thought there was another one there, Kaylin. Many of you who have been coming to the calls, webinars, know about the training of trainers that we've been doing. I just wanted to let you know we have one coming up December 9th through 11th in Yakima. And then we have another one in Northern California in late winter, and we have several others that are still defining their exact dates and locations into 2016. But if you're interested in knowing more about those as they evolve, then Martha Reeder would be the contact at the Alliance for that. Registration for the one in Yakima closes this Friday. So if you're interested, make sure to let Martha know about that before then. And we did just have an opportunity that has come up to do a presentation to some policymakers related to some of the work the Alliance is doing and work with our colleagues and network around the country. And one of the areas that we will touch on will relate to the intersection, and Kaylin, this relates to what you were saying too, the intersection where child welfare systems around the country are looking at incorporating or embedding a protective factor framework in their work. We know of some of the states we're working with, some of the states where we have certified trainers who are training child welfare workers. But if any of you are doing that work and we may not be familiar with it, we would love to hear about it. We have a very quick turnaround, so we would need to know by Monday if you have any information that we could include in that presentation. We have to submit our presentation on Tuesday. And that could just come to me or Meryl. You'll see our contact information at the end of the slideshow, but we would welcome any input you have from that and would like to highlight the work that you're doing if possible. So thank you so much, and I'll turn this back to you, Kaylin.
Thank you, Teresa. I'm so sorry that some of your slides dropped off. I'll try to add those back in for the PowerPoint that will be posted on the website. So if anyone goes to grab that, they can see the images that were meant to go with that.
No problem at all. Thanks.
All right. So I'm very excited to welcome our guest speakers for our main topic today. And I'm just going to switch over to their presentation. Meryl Levine is a senior consultant with the Alliance, and Sandra Colette is the executive director of the Child Welfare Organizing Project and a member of the Birth Parent National Network. And they are going to talk today about preventing child neglect. And I know everyone's eager to hear what they have to say. Welcome, Meryl and Sandra.
Thank you. Okay, thank you so much, Kaylin. Sandra and I are both very, very excited to be here today. And I wanted to just introduce myself a little bit more to give a little more background about me, as well as let everyone know a little bit more in terms of Sandra's experiences as well. I am a senior consultant, as Kaylin indicated, with the National Alliance of Children's Trust and Prevention Funds. I have over 30 years of experience. I hate to say it's that much at this point, but it is in the child maltreatment prevention field as well as the child welfare system. And I've managed a variety of programs, including prevention, in-home family services, child care, foster care, adoption, and group homes. But for the last 20 years, I've really been involved in doing extensive work primarily with parents. And that has probably been the most exciting and rewarding work that I've been involved with. And the type of work that I've been doing is engaging parents in decision-making processes to help include their voice in decisions around policies and practices that would help improve outcomes for families. And so in my work with the Alliance now, I've been primarily involved in projects that have included work with birth parents, as well as all of the work that I've been doing here with the Child Neglect Prevention Initiative as well. I'm the lead person with the Birth Parent National Network, which Teresa just provided some additional information to all of you. But one of the greatest results of my work with the Birth Parent National Network is having the privilege and the honor of getting to know Sandra Colette. She was involved in the very beginnings when we were starting out in terms of shaping what the Birth Parent National Network would look like, and she has stayed involved in a tremendous kind of way all the way through till today. So, and if some of you were on the most recent call when we had Dr. Sanders as a keynote presenter, both Sandra Colette and Tony Miner were the two main co-facilitators for that particular, the virtual convening. So without ado, I wanted to turn it over to Sandra so she could also introduce herself, and then we will get on with the presentation. So Sandra?
Thank you, Meryl. So again, thank you to the Center for the Study of Social Policy. Kaylin, I really appreciate being a part of the dialogue today and expanding the conversation to build a healthy communities and prevent child neglect. As Meryl stated, I am a parent that was affected by the child protection system in New York City. I have two sons, and I relocated back to New York to be near my family. And unfortunately, my son, the oldest one, was having adjustment issues and was experiencing a lot of aggression and behavior. So it was at this point that I, as a parent, was seeking out services to support me in helping to raise my son. Little did I know that seeking those services would then thrust me into the child protection system. So for about 2 years, my son was actually placed in foster care. And I have to tell you, it was shocking, surprising. I couldn't understand what it was that happened in the family that would rise to that level that they would want to remove my son. Certainly, what pursued was not something that was of threat to him nor the family. We were a very intact family with very strong protective factors. We had community relationship, concrete support in my church, community, and school, extended relatives, and we were familiar with lots of resources in the community. And so I didn't understand why he would need to be in foster care. So with that being said, nevertheless, the experience forever changed me and my family. But I think for me, it was an enormous change. It hit the heart, and it made me think about other families. Once I got involved with the system, I realized that there were so many other families involved in the system. So that brings me to where I am today and how I came to become this advocate and just very persistent and passionate about the system, meaning the child protection system and or any systems affecting families, provide intervention, prevention to preserve families so that we can raise our children in our homes and in our communities, in strong communities, in a loving, nurtured environment. So I began to seek out areas where I could do this, and I am currently the Executive Director of Child Welfare Organizing Project, but I did not become that Executive Director just because I wanted to be the Executive Director. I think it was all of the experience that I had with the Child Protection Services that led me to Child Welfare Organizing Project, in which I went through the leadership curriculum and became a parent advocate, which is the title. There's various titles, but I became a parent advocate. And it was at graduation that I committed to making sure that no other family who needed something to make sure that they could raise their children would go without it. And I have dedicated myself to that for almost, I think, 10 years now. I could have been doing anything else, but I can tell you that this system, child protection, touched me in a way that forever changed me. I will never look at it the same, and I will not stop doing the work to make sure that families and communities can have what they need to raise their children. So I mentioned a little bit about the protective factors, and one of the things I do know is that I was aware that I had a very stable home, right? But at the time, I didn't know it was protective factors. There was no name to it, right? So I knew I was active with the community. I knew about the development of my children. I knew that I was engaged in their lives. I knew that we had an enormous amount of supports in place. But I never called them protective factors. I've come to learn today that I had such an enormous amount of stability in my life with those protective factors that when the system, child protection, entered, it actually destroyed the protective factors. So the one that was missing was the concrete support, the concrete services. And that's what was missing. That was the weak link, I would call it, right? And we were trying to get those services for the family, but we could not. And so that's really what I needed when CTS entered my life. But they did not see that as the issue. They saw my parenting as the issue. And the moment they removed my son, all of the protective factors began to drop away. They began to crumble. And thereby, it caused almost a ripple effect for my youngest son, in that he, in return, needed additional services, counseling, from an outgoing a child to withdrawn, missing his brother, and yet still we were not able to get what we needed in the family, even after they removed my son from my home. So if you don't understand, I will tell you again, that is why I am adamant about doing the work and passionate about doing the work, and I will not stop in my endeavor to change city, state, and federal laws that impact families so that families can receive intervention, prevention, and resources to raise their children. And if there's anything else, Meryl, I think I will turn it back over to you, and then we'll follow through with the rest of the conversation.
Okay. Well, I'm hoping, thank you so much, Sandra, for sharing that. And I think that if everybody has listened to some of the experiences that Sandra has gone through, she certainly is a very passionate advocate, and one of the key reasons that I have selected her to work with us as we move forward in expanding the conversation to really build healthy communities and prevent child neglect. So Kaylin, if you could go to the next slide, I'm hoping that in the time that we do have left now, that we could really just talk about what we know about neglect, the Alliance's neglect prevention work that we have done so far, and then move into really expanding the conversation and the kinds of messages that we want to help communities and individuals and organizations promote, so that we can really mobilize some major support to move the messages forward to build healthy communities and prevent child neglect. We will close out at the end of the presentation in terms of some brief tips about what you may be able to do, and hopefully spur some continued conversation all across the country with all of the representation that we have here today on the call. So in terms of, if you could move to the next slide, Kaylin, just for those, I know that we may have some new people, but most people I think are familiar with who the Alliance is and also the Children's Trust and Prevention Fund. But I just thought briefly I will highlight that the National Alliance of Children's Trust and Prevention Funds, which we continuously refer to as the Alliance, is the only national membership organization for state Children's Trust and Prevention Funds. And the Children's Trust and Prevention Funds really form the backbone of our nation's infrastructure to support children and their families. They exist in 48 states and focus on strengthening families to prevent child abuse and neglect before it occurs. Children's Trust Funds promote and support prevention efforts at the individual, family, community, and societal level. And overall, we annually provide about $200 million in funding for statewide and community-based strategies to strengthen families and prevent child abuse and neglect. Okay, Kaylin, can you move on? Okay. Overall, as many of you know, the Alliance has invested over 4 years of really significant attention in gaining understanding about child neglect and promoting strategies to help build healthy communities and prevent neglect. Many of you may have even been involved in some of the work that we've been doing. Our work has evolved through a review of the literature, conducting original research with many experts through key informant interviews, and creating multiple written resources, including a comprehensive theory of change. On the definition, what we are really looking at, there's a lot of different definitions of child neglect, but this is the one that most people can agree on. It is a failure to meet children's basic needs, whether the failure is the responsibility of parents, communities, or society. And this void places children in harm's way. Next slide. This is really a key diagram that I really wanted to talk more in depth with you about. We know that children benefit from strong families and safe communities where their needs are met. And most children are growing up with these supports. Unfortunately, there are many who do not. When their needs are neglected, their growth and development is affected, and of course that's causing lifelong costs for them as well as to all of us within our society. On our website, we have a variety, a wealth of information, fact sheets around data related to neglect, and we have also a great deal of resources that talk about the seriousness of this problem. Today we're deliberately not sharing all of that detailed information specifically around the data on neglect, because we really assume that many of you are already aware of it. And we do believe that in the past, when we have shared a lot of that data, the data becomes so daunting, it's discouraged people from really taking any further action in terms of addressing the issue of child neglect. So we want to take a more strength-based approach, and we want to focus, as we continue to talk today, around positive ways that we can begin to get messages out there about preventing child neglect. So that's really what we're hoping we will accomplish in expanding this conversation to talk about strategies to prevent child neglect. So, but even loving, nurturing parents do have difficulties meeting their children's needs. Some communities face challenges in providing an environment that promotes positive outcomes for children. There's really a very fine line sometimes between parental neglect of children and societal neglect of families. And it's really sometimes very hard to tell the difference. This diagram clearly illustrates that in addition to child neglect by families, the community and the society also may fail to keep a child safe from harm. This is a very different way of looking at conceptualizing neglect. When we speak about it, many think of only that one quadrant, parental neglect of children. But our review of the literature and our work in terms of researching information around neglect has convinced us that the only way that we can really look at this is to look at all 4 of these quadrants. And in this way, we think that we'll have a much better way to prevent neglect. So this framework has become a very important component for us when we developed our theory of change. Can you move on, Kaylin, to the next slide? Okay. The good news, as everybody can see at the top of this diagram, is we really can prevent neglect. And that is really what we're all about today in terms of expanding those kinds of messages. Everyone on this call is familiar with the protective factors framework. Sandra talked a lot about it in her own particular story. The Alliance has spent over a decade helping to promote and implement the protective factors framework around the country in partnership with our colleagues at CSSP. When we began focusing on preventing child neglect, we knew that it would be a good fit with all of the work that we are doing in helping families build protective factors. And this slide really shows the link between the risk factors for neglect and the Strengthening Families Protective Factors. All of you as leaders in promoting the Protective Factors framework are probably familiar and knowing that we're already doing a lot to help reduce the risk of neglect. But we want to take it a step further, and we wanted you to know about additional ways that you may be able to help to prevent neglect today. So today we just don't have the time to go into all of the detail in terms of all of the additional strategies, but we do hope you will go visit the Alliance website and look at more of this information in more detail. But when you do look at this diagram, you see the risk factors for neglect fall across every level of the social ecology, the individual, family, community, and society. The strengthening protective factors that you see on the right-hand side are the key elements in mitigating the child neglect risk factors, and you see that they are highlighted in a more bolded text and stand out. You'll see others that are not bolded that we have added onto this chart because these are additional factors that we've identified through our key informant interviews and our literature reviews. Okay, so let's move to the next slide. And here we are really, before we really could take and do any kind of collective action, we really needed to develop a guide to change based on the current research and all of the information that we had gathered, the critical thinking of the experts in the field. So based on all of that information that we had really studied, the Alliance created a theory of change to help all of us better understand how our individual actions really could have a collective impact. And as you can see, there are a really long list of things that we each can do at each of these 4 levels of the ecological model, the society, at the individual, family, community, and societal level. Across the bottom of the chart, you see that the 4 areas of the social ecology, there are indicators of what it takes to achieve the outcomes that are highlighted above in each one of those columns. So you can see in these lists, like under society, that one would lead, if you take these kinds of actions, we're projecting that you could reach a humanitarian society. For the community, the actions to take would lead us to a supportive and healthy community. And same in terms of family, strong and stable families, and at the individual level, safe and healthy children. So all of these outcomes, our goal would be to lead to meeting the goal of meeting children's physical, social, and emotional needs. And when this goal is met, we've created a condition where neglect would not be likely to occur. So that's what our whole theory is all about. And we do believe that in order to take these tasks on, we believe that everyone can take a role in helping to move this kind of an effort forward. It's not complicated. It's all about us coming together, each of us doing the best job we can do to provide a safe and supportive environment for our children. Over the years, I've really had a lot of opportunity to talk with a lot of different parents about what made the difference in helping them move and change their lives around. Although there were many different responses that I got, I do have to say to you that the majority of the answers were it was due one person in their life helped to change it and move them into another stage and help them to change their life dramatically and make improvements so that they could meet their children's needs as well as their own. And so that gave them some hope. And so what we're really talking about here is relationship. We're talking about hearing, I remember hearing some of the parents say to me, it was my teacher, or it was my coach, or it was my home visitor. I really trusted Mary. She's the one that helped me move to the next step in the level of where I was at. But we, as individuals now, can also take a part and possibly be that one person for another family to help them move to that next level. So after today's webinar, we're hoping you will go back and identify areas from this particular chart where you could actually take action in your own community. One thing you can do, based on what I'm just knowing right now, is be the one personal connection to another person. That's one way you could actually contribute to helping to prevent child neglect. And now I'm going to turn it over to Sandra, who's going to talk a little bit more in terms of the essential actions based on this theory of change. So Sandra?
Thank you, Meryl. So I would like to just reiterate something that Meryl said, and that was that one person, one individual who made a difference. And so for me, if I could just give you just a little more information, it was, again, with the protective factors, it was that school connection with me and my family, and the school being able to help me see what was going on with my son. Thereby, I sought out services to help us. So it was because of that relationship that I already knew that there were some challenges that needed to be addressed. And I was looking for someone in the community, meaning, unfortunately, child protection at the time, to help me get those resources in a quick way. So I think what we have to acknowledge is that, one, it's not all about the family. And I think if we can just begin there and say that we have an obligation to make sure that there are healthy communities in our quest to prevent neglect. We also have to recognize that, you know, the risk of inaction is enormous, and we must do something. We must, if we see that communities or certain area that you're living in or you're working with families, that if that community doesn't have, you know, a park, or if that community lacks extracurricular activities for families and children, there's a need for us to speak out about that, organize around it to make sure that the community can get those things, which we know contribute to healthy relationships, healthy kids, and healthy development. So I think that, you know, those are some of the things that are essential, that we can take and help with developing healthier communities. And from the society's perspective is that it's all of our responsibility to prevent child neglect. I can tell you that I have various experiences in which, you know, I know that certain laws actually contribute to the possibility of a family being neglectful, right? And it's not because the family wants to be neglectful, it's because they've been put in a situation where they're forced to make a certain decision. And at the time, for a family, if they're on a work experience program and it's tied to receiving their public service benefits, right? And they've been told that you have to work for your benefits and you don't have adequate child care, and if you don't go to that job, we will probably cut your subsidy, right? So the family makes the decision, maybe the kid can stay home by themselves, it'll be okay. They make that one decision, that makes them neglectful if something happens. I can give you so many examples of how, before my son was actually 13, that I could have been a neglectful parent. I could have been a neglectful parent if I had failed to fight for, and I say fight, others will say or advocate, but if I failed to fight for a housing subsidy. So the mere fact of being homeless or living from house to house would have put us at risk of going into a neglectful situation, not having enough resources and income to actually take my son to school. If I would have chosen to jump a turnstile with my kids, that would have been a neglectful situation, thereby rendering me into the criminal justice system. So every day families are making these decisions, and they shouldn't have to make these decisions. These shouldn't be decisions that would render a parent neglectful. And there is the assumption that families that are in neglectful situations, that there's something they could have done. And I ask us to look at that differently, because in all honesty, if there was something that I could have done, I would have done it, because no family wants to be in that situation where they can't provide or can't do for their family or their children. So we need to continue to develop partnerships with resources that also understand that we can prevent neglect and they can help families build their protective factors. We need to embrace strategies that strengthen families and communities in a holistic way so that we can prevent neglect. And I will also say, you know, I can't say it enough, that taking action and promoting the protective factors framework and not the risk of families, and seeing families as a whole as part of a bigger picture, and in all areas of the social ecology, the individual, the relationship, the community, and society. And if we look at families in that way, surely I know that we can prevent an enormous amount of negative impacts that come along with families and children not having their basic necessities that they need. And I, again, will reiterate what Meryl said. I'm sure that you all on the phone today are doing as much as you can, but I can tell you that promoting protective factors and acknowledging that we can prevent child neglect is another great step that you can add to your toolkit in order for us to make sure that children are growing up healthy and safe in their families and the communities with everything that they need for a loving and nurturing environment. So, you know, with that said, I would like to say that the conversation to build healthy communities and prevent neglect, you know, we can begin to develop effective messages to increase public support and policies for programs that improve children's and families' lives. And I would like to say that, you know, for me, there's an example of, you know, my local congressman, right? And the fact that if he signed off on a policy pertaining to a temporary assistance to needy families, and it was to decrease their public assistance or their SNAP, or it was to penalize them if they did not go to that work experience program, you know, I would have to call him out on that and say, you know, do you understand that that very stroke of the pen you just signed off on that law is also going to impact that family into a potential neglect situation? So understanding and making the connection about the things, the laws that are in place that also contribute to the potential for neglect. And just standing up and saying that we must do something different if we want to prevent neglect. I think also, again,
Sandra, I think we should move to the next slide, and you can continue with that conversation around the messaging, because I think you've kind of moved into it anyway. So why don't you
so you
kind of highlight?
Sure, you can go to the next slide. And I would say, you know, making the connection and focusing on, you know, it's everyone's responsibility for the welfare of our children, and we can do more together. So reaching out and talking about preventing child neglect and promoting the protective factors. And, you know, a key message, I believe, is the whole community benefits when children grow up in a healthy, productive way. They can be very productive adults in society. Because we know if we pay now, we don't have to pay later. And when I say pay later, I mean in a sense in a negative way. So putting all that we can into supporting families up front will, I believe, ensure that we have productive adults later on in life. So I think that I've went through just about all of the key examples. And I think we just have to change the dialogue, right? And I said that up front as well. I was blamed as a parent for not being able to get the resources in a timely manner for my family. But I think we definitely cannot, and we have to stop doing that. We have to believe that families want the best for their children and their communities, and they want to raise their children safely, and they really just want the best, right? And they want the means to be able to give them the best, as well as raising the the awareness around the effects of poverty and how that plays into potential neglect. So I think we can move from expanding the conversation all the way to the quick elevator speech, right? So what would that look like? You can go to the next slide. So some key components in the elevator speech is identify, you know, the problem we're trying to resolve, right? And that is we're trying to solve neglect and addressing and meeting the basic needs of children. So we want to make sure children's basic needs are met. Invite the interest. I can't tell you that I know that as soon as you say children and prevent something from happening, you get an interest. You know, people will stop and listen. And give them the simple ideas and concepts around what would make a difference in a child's life, in a family's life, in a community's life. And I also invite you to think about and share with anyone you encounter what made a difference in your life. You know, someone taking you to a soccer game or having a field to play soccer in your community. You know, those things that we normally overlook for families, but they can make an enormous impact on how a family and a community become stronger. So I would also say in your invitation to talk about preventing child abuse and neglect, there must be a passion in it. You cannot waver from it. You cannot let folks think that there's nothing that can be done about it, because it absolutely is. And there are little things that can be done if we are aware and take notice in our communities about what is there. And if we listen to the families about what they need in their communities, we can make an enormous impact. So if you would go to the next slide. So I just went over what can we do now. So what we can do now is to reframe the issue of neglect and move the discussion from incriminating parents. We need to change the way that we talk about the issue so that it can be heard by all, even those that do not share our perspective. And you gain allies in some very, very weird places when you open that experience up and share with those who might think differently than you. I think also communicating the importance of child neglect prevention to our family members, neighbors, work and colleagues and others, that there's something everyone can do. Mobilize your community supports and information as well as referral services to help families to access them. One of the things we do, and we do a few things, but you know, we teach around the protective factors. We talk to families about assessing what protective factors they might already have and what protective factors they might need to strengthen for their families. And we encourage them to also talk to their families about what protective factors look like and what a strong family looks like, and utilizing that from their perspective of what they already have, and not so much about what we need to give them and how we need to change them, but the strengths that they already have and the protective factors they've already built up, and the ones that are weak, we help them build them up. Again, mobilizing supports and information for families across all systems, broadening the dialogue with policymakers about the consequences and the effects. I use the term pay now, pay later. Talk about why it's important to invest in families now and engagement now, and having a dialogue with our federal government about federal investment in families and community. Partner with parents in promoting effective messages to build healthy communities and prevent neglect. This is a great resource. Families listen to families, parents listen to parents, and word of mouth is a great way to share preventing neglect as well as promoting the protective factors. And we just need to diminish the shame of parents asking for help and acknowledge that, you know, families are not different than any other families. They just may lack resources to go out and get what it is that they need for their family. So they're not a mystery. Every family has a crisis. And I think last but not least, but very important, is to join the Birth Parent National Network. And also in your prospective jurisdictions, look for parents who you can talk to and link up with to talk about really complex social issues. For example, helping parents talk about their stories in a strategic way and communicate a message that will allow them to influence policies in their various jurisdictions, helping them and being prepared to go to their local political leaders and talk about what's needed in their communities. And so you can do that in your local area, looking to partner with parents, and also join the BPNN Birth Parent National Network to find out if there are parents in your area who may be interested in working with you on neglect prevention strategies. And to join the BPNN, please email info@ctfalliance.org, or you can learn more at bpnn.ctfalliance.org. And I think at this point, I'm going to turn it back over to Meryl. Meryl?
Meryl, are you there?
Yes, can you hear me? I'm sorry, I had my phone on mute. I apologize. I'm just going to wind up really very quickly and just show this slide. We have, as I've indicated all the way through the presentation, a variety of different resources related to neglect prevention. And if people are interested in accessing them, they would be on the Alliance website. And so we've really got some great resources, and we encourage you to take a look at them. The last slide I'm going to just do very, very quickly, and that's just basically to say to everyone, between with all of what we've shared between both myself and Sandra, we just want to hope that you'll join with us in getting the messages out. Building healthy communities and preventing child neglect is really more than a family matter. We need to share responsibility. Preventing child neglect will take the concerted efforts of individuals, communities, society at large, and we need to work together to help ensure all children grow up free from harm, with their needs met, and with adults who care for them and about them. So those are the key messages that we hope that our materials will help you move this forward, and that you'll feel comfortable to talk with the Alliance or contact us, and we would be happy to work with you in terms of promoting child neglect prevention in your local areas. So with that, thank you very much. Kaylin, I'm going to turn it back to you.
All right. Well, thank you so much for that presentation. I'm so glad that you were able to share all of this. And I want to make sure people notice that the contact information is up here for Meryl and for Teresa Rafael, who spoke earlier. Do go to ctfalliance.org to explore all of those resources. And I see that some questions are being typed in. I'm not sure if... Okay, it looks like people are thanking the presenters, which is very important, and I appreciate everyone letting us know how it's going, and I hope that you will join us for future webinars. We'll be back together on December 10th, and look forward to that. Thanks, everyone. Have a great afternoon.
You too.